Hi, everyone. Welcome back to Mama Genius Podcast. Sorry, a little tongue-tied today. Been at this all day. But I got Manna here today, and we're going to dive deep into the aspect of menopause. But she has so much enlightenment for us. We talk also about the perimenopause because a lot of us are in that stage. There's so much to know, so much, and she's just going to offer so much goodness for us to think about. So I'm going to dive right in and just give you a little bit about her before we get started. So Manna Semby is an ND IFMCP, naturopathic and functional medicine doctor, specializing in preventing chronic disease with special interest in menopause and brain health. So she's going to put that together for us. Having navigated her own health challenges, she is passionately committed to empowering women over 40 through their personalized care and education. Her clinics offers comprehensive wellness packages focusing on hormone optimization and metabolic reset, backed by silence, and I love this, empathy, because we really need to have that grace and empathy when we have this subject. So I just wanted to start by welcoming you first of all to the podcast, Manna, and just jump in right away by asking what sent you down this path?
So thank you. First of all, I'm delighted to be here. So this is not my first career. My first career was actually in finance, and I was in New York City working at a big bank. And my two sons were born, and they were diagnosed with autism at a pretty early age. And conventional medicine, which I used to love very much, our pediatrician told us that there was nothing she could do for us, and my children would probably need therapy for the rest of their lives. And I was quite disheartened, and I realized that I would have to find my own answers. So I started down a path of alternative and complementary medicine, looking for answers wherever I could find them. And so I went to grad school, naturopathic medical school, graduated. And then, the neurological problems had a big draw for me because my own children's challenges taught me something about how these conditions affect families. But I wasn't ready to work with children. I wasn't ready to work with children with autism or other conditions because that was too close to home. So I decided to focus on the other end of life. So I started to focus on Alzheimer's and dementia. And I got trained in a program called Recode 2.0, which was developed by a neurologist, Dr. Dale Bredesen. And what I learned was that dementia is actually preventable, but most people do not know that. Dementia is preventable, Alzheimer's is preventable. And he has done a proof of concept trial, which has shown that 84% of patients that go through this program can reverse their symptoms of Alzheimer's. Now, we have to bear in mind, that it really depends on where on the journey you are when you start the protocol. So if you are further along, the changes that we are able to make or the reversal we are able to make may be lesser than if we are able to start earlier. So that was one real big moment of learning for me. And I was so grateful to learn that, and also just so gratified that this is possible. So whether it is genetics or other factors, whatever may be the reason, dementia is preventable. So I learned that first. And I started working with a lot of patients who either had Alzheimer's diagnosis themselves or with children in their 40s and 50s who were concerned about their parents, or even adults in their 40s and 50s who were concerned about themselves developing Alzheimer's down the road because they've been caregivers for their parents. So that was a period of immense learning and growth for me, and kind of seeing, like, if you do the right things, dementia is preventable. And then a while ago, I was diagnosed with breast cancer, and I was also going through menopause at this time. And I had started hormone replacement therapy for myself and seen a lot of change in my own health. But what happened was that the oncologist, the surgeon, pretty much everybody on my care team wanted me to be off the hormones. And while breast cancer has a lot of little details to consider, like whether you're hormone positive or hormone negative, and at what point should you not take hormones, should you keep taking them. There's a complex algorithm that you can go through. But for me, it was pretty clear that I needed the hormones, and I was also hormone negative cancer. So when I went through this experience, I learned that even doctors are not educated on the latest research in hormone replacement therapy. So I just became so passionate about advocating for hormone replacement therapy usage amongst women, with an added emphasis on women who are concerned about breast cancer or who have a personal history of breast cancer or a family history of breast cancer. So, kind of like this menopause, HRT, and brain health kind of like became just my passions. Like, these are areas that women really need help. These are problems that we can solve. We just need the information, and we need the right and compassionate care, and we can do pretty much anything we want to. So that's a long answer to the short question of why.
Well, I just love that, but I love how you sum that up, that we have such capabilities, such possibilities, but it is a lot of the lack of information, which is why I really wanted to have you on here, is because the more we see, the more we know, the more we see those possibilities, the more we can do something about that, and we start to see what that is. So I kind of want to start with, what are some of the like symptoms, or what do you think some of the women are feeling that might not know this could help them?
Right. So, the most common thing that people talk about when they talk about perimenopause or menopause are symptoms like hot flashes or night sweats or insomnia. These get talked about because hot flashes are kind of like you can't avoid them. If you're having a hot flash in the middle of the supermarket or at work, or while conducting a meeting, there's nothing you can do to mask it. So it's almost kind of become a joke that, well, I'm having a hot flash, so give me a moment, or something like that. Um,
PMS
so,
too.
right, right. So these symptoms are something that's pretty commonly known. However, it's important to note that these are not the most common symptoms. The most common symptoms that women experience during perimenopause and menopause are brain fog, memory loss, joint pains. Um, a lot of women also experience painful sex. They may experience recurrent UTIs, urinary tract infections. They may have joint pains, muscle pains. They may have ringing in the ears. They may have digestive issues. A lot of women will will notice body composition changes. They begin to gain weight around the midriff. So, a whole lot of symptoms are associated with this change in life. Um, Also, things like mood changes, anxiety, and depression, which is not long standing, which is not something that you've had all your life. If there is something that is stressing you out, you are beginning to get anxious, you're getting irritable, you're getting angry, um, and you're finding that you're getting burnt out. You're getting burnt out. And so a lot of women feel that burnout happens because there's just so much going on in life. And it is true. By the time we get to 40, we have a lot going on in our lives, right? We are
Right.
managing children, we are managing careers, we are managing businesses, we are managing relationships with our significant others, we are managing relationships with our parents, we are managing and caretaking for them if they need extra help, we are running the household. We are doing so much. And it is so natural and normal to think that burnout is to be expected. However, what I have found, and in the women that I work with who were not on HRT and have subsequently started HRT, and I use that acronym because it's an acronym that we all should be very, very familiar with. It's hormone replacement therapy, and we just call it HRT for short. So what I have seen is amongst women that were not on HRT, and after they've been on HRT for about 3 months, there is such a huge difference in how they're able to manage life and circumstances. you know it's not that problems go away, obviously, right? It's not that problems are going to go away, but it makes a big difference to our resilience. It makes a big difference to the energy that we bring to pretty much everything we do. It makes us more resilient dealing with kids with patience and grace. It gives us resilience to deal with our partners with resilience and grace. We can manage our work. We can continue, go for that next promotion, expand your business, whatever you need to do, you can, if your hormones are on board. The other thing that I think we need to understand is, um, And maybe I preempted your question, Michelle, because, one of the things that I have a problem with, and I wonder, is like this word menopause. It's become like a dirty word. It's like a
Yep.
bad word, right? It's a word that has a lot of liability. There's a lot of baggage. People don't want to talk about it. Women don't want to talk about it. And I am so surprised to see that even close friends don't really discuss this amongst each other. There might be a little bit of commiserating, oh, yes, I've been suffering, but what to do about it? Um, People are not really looking into it. And maybe they think that not much can be done about it, but there's a lot that can be done about it. So
I think you just hit the nail on the wall, though, by people just not thinking there can be done. And so that's why I love this conversation with you and bring in some of the tips and things that we can start to do about this, because that is so important and so vital. And so just thank you so much for being here and like join this conversation, because you're so right. Like if we don't start having these conversations, it's not going to happen. So let's just dive straight into that.
Okay, great. So one way to understand menopause is what it really is technically in the body, right? What it technically is a long-term hormone deficiency. That's basically it. Whatever word we give it, and one of my passions is really to redefine and rebrand menopause as a kind of metamorphosis, because that's what it ended up being for me. But whether it's a negative word of menopause or so-called negative, let's say not everybody views it as negative, right? So whether it's menopause or metamorphosis, what it really is in the body is a long-term hormone deficiency. So now think about it. If you have a thyroid hormone deficiency, would you take thyroid hormone or not? Right? You would take thyroid hormone because it is so important for your metabolism. It's so important for your energy. It's so important for so many functions in your body, right? So if you know that you are going to have a long-term deficiency of anything, you are going to supplement with that, right? So some women, let's say they are lactose intolerant, right? Because they lack the enzyme to break down the lactose, to break down the dairy. So they take an enzyme called lactase, and then they can have dairy. But this is more often than not something that they have to do long term. So it's something that the body doesn't produce anymore, and you're just going to supplement it. That's basically all it is. So your hormones, so the technical definition of menopause is um, when your ovaries completely stop producing estrogen and progesterone, right? And it generally happens, the average age of menopause in the United States is 51, which means that the average age at which a woman has a last period is 50, right? And before this happens, there is a long period of perimenopause, which can range from 2 years to 7 to 10 years, right? So if the average age of last period is 50, then perimenopause for many women begins around 40 or early 40s. If you consider early menopause, which is becoming more and more common these days, that is menopause before the age of 45. So perimenopause for those women could begin at the age of 35 or around then. More and more women are now having their babies when they're 30 to 40.
Yeah.
So, and a lot of women are also having trouble with fertility because, unknowingly, unwittingly, they're already going through menopause, premenopause, perimenopause, which is when their hormones are fluctuating. So fertility can become a problem. But also, they may have young kids. Their kids may be just 5 years old or 10 years old, and they're in the throes of perimenopause, but they do not know yet. So there is a whole inventory of symptoms that you can check and see, like, oh, if I have these symptoms, it's probably perimenopause. Because if you go to your doctor and ask them to check you, do blood labs or something, they're not very reliable at this stage because your hormones can change by the day, during the day. So one lab can come back and show everything in the normal range, in the normal range. And the next day, if you did the same labs, it might come out very low or very high. So unfortunately, we really have to go by symptoms at this time. Like, what are you feeling? What are you experiencing? And that's one way to start. But the most important thing is for women to start sharing this, start talking to each other about these symptoms that they're having. like nobody told me what to expect when I would go through this stage. Nobody tells us actually, you know, and we go into this stage of life totally blind, and we hope to just come out okay on the other end. It's basically just hope, right? And we know hope is not a strategy. We need a plan, right? So if we educate ourselves, we talk to each other, we go to the right resources to get the information, we can make a huge difference.
So I want to break that down a little bit, because you mentioned there's like a sort of checkoff list or something that women can start. Where would we get this, or what kind of things should we be looking for to start this list?
Right. So the North American Menopause Society, and the website is menopause.org. They have developed quite a comprehensive questionnaire, and it's called it's basically just called a comprehensive menopause questionnaire. It's like a 13 or 12 or 13 page questionnaire, and it asks for a lot of information like your family history, your personal history, meds, all that stuff. But then there is one page, I think it's page 7, and it's section 13 on that page. It's a one full page, and they list these commonly experienced symptoms, and you go from you experience it not at all, a little bit, somewhat, a lot, kind of like a grading scale. And so it has all these symptoms like hot flashes, night sweats, insomnia, joint pains, brain fog, memory loss, a whole page of that. And I can provide you a link for that so that people can do this, evaluate themselves, and kind of see, okay, if they need help and need to reach out to somebody who's knowledgeable.
So then my other question is, because you mentioned a lot about the hormone replacement therapy. So do you think that most women or all women are going to need this at some point in their life? Like,
Every menopausal woman should be on hormone replacement, unless there is a very clear reason that they should not be on it, right? So the risk and benefit analysis should be done in each woman's case. Okay. But the benefits so far outweigh the risks that I would think that 97% of women would be on hormones once menopausal. And sometimes it makes sense to start the hormones when you're still in perimenopause, still having periods, because the swings are too crazy. And when you go with what begins to happen is that your period begins to get irregular as you go through perimenopause, right? It may no longer be a 28-day cycle. It may become a much shorter or a much longer cycle. Your periods might become heavier, longer. You might get to a period like every 3 months or every 2 months, something like that. That's when you know that the ovaries are trying really hard to put out the hormones, and sometimes they succeed and other times they don't, right? So when you are going through this time, changes are already happening in your body. For instance, let's take the example of bone health. Osteoporosis is a big concern for women. So what happens with this irregular hormone production in our body is, when the body goes through even a 3 month period without adequate levels of hormones, our bones take a direct hit. Okay, so in the time just before menopause, actually, the rate of bone loss in our body is the highest, is the fastest rate of bone loss. So in some women, when the swings are too wide and they're getting their periods every 3, 4, 5 months, it might make sense to start the hormones at that stage. But pretty much every woman should consider hormone replacement, and only after a very complete and thorough analysis should they say no if their situation warrants it. If there's any reason that they should not be on hormones, then of course, but for the most part, most women would do just fine to be on hormones.
and so should they be having these conversations with their gynecologist or a specific doctor, or who do they have this conversation with?
Yes, you would think that the gynecologist would be the right person. Unfortunately, my experience has been that it really depends on the doctor themselves. There are gynecologists that are very up to date on all the research and would be happy to talk to you about this. And there are gynecologists who have not kept themselves up to date with the research and are not able to advise you. Also, it's kind of like there's a big association and fear associated with breast cancer and hormones. There is a big fear associated, but that is based on incorrect information, you know. So So it's really important to talk to somebody knowledgeable. So you might ask your gynecologist or your other practitioner, like, what do they think about HRT for them, for that particular, for each person should reach out to their doctor and say, look, what do you think about HRT for me? Because that's always a question. What do you think about it for me in particular, right? And depending on that answer, you will know if they're the right practitioner for you or not. And then you can decide if you need to change practitioners, if you need to find somebody else. And what you can also do, if you go to the menopause.org website, you can also find a list of um, Menopause Society's certified practitioners. So these are doctors who have taken additional certification to learn about hormone replacement, and they would be able to guide you. The problem is there's only about still less than 2,000 such certified menopause care specialists in the country. So not
Wow.
enough, not enough. Where I
Wow.
live, there's
Taking
only
that in.
yeah, there's only 2,000. So, but this topic is gaining more and more traction, more and more interest. More women are interested in at least hearing about it. So there will be more and more practitioners as time goes along. But we collectively need to ask doctors and everybody else that, menopause is not a word to be ignored. Menopause is not a stage to be ignored. We need help, and we need you to do what is in your power to do it.
I love that so much. I mean, you gave us so many great tips, like the checkoff list of what to even look for. That's priceless because I feel like you just you don't know, and you're right. Until you have the information, and then where to actually go to ask these questions. I love that they have this, but I honestly, till I've had this conversation with you, I didn't even know. So I'm hoping those and expecting those that are listening right now having that information gives us a place to start. And I love that you
Yes.
said that. Let's just keep having these conversations, having them with each other, telling each other about these organizations and these things that are there so that there'll be enough demand to require
Yes.
more of it. Again, back
Yes.
to supply and demand. And that's what this is all about. But since we're running out of time, we're going to lead into our 5 questions. You gave us so much ideas, and I really hope those ideas, that information at your fingertips. But we're going to our 5 questions that we ask all of our guests. So number 1, share a book or research that has had a significant impact on your journey as a mama.
So my journey as a mom has been quite interesting, right? Because I have 2 kids and they both have autism. So we are a slightly different family, right? For me, what has been most helpful is just getting myself in order, just getting myself put together in a way that I feel at home in my body, in my mind, in this world, in my home, with my children. So for me, the journey has really been finding myself, right? Finding myself. So as a mom, the thing that helped me the most, and I had a stack of books here to share about menopause with you, but I think the book that really helped me is this one called The Alchemist by
I
Paulo
haven't heard that
Coelho. Paulo Coelho's book. It's actually a very popular book, and he's written a bunch of books that, but it spoke very, very deeply to me at a very difficult and challenging time in my life, and kind of was instrumental in me coming home to myself. And I find that once I did that, everything becomes just so amazing. So that's my book.
It's so true because I mean, as I go through the personal development journey or just my own journey in general, that's what I've it all comes back to figuring out how to get to your home. I love the way Martha Beck actually describes it. She calls North Star, but she also says that we've been sending ourselves all these gifts to our home. And so all these manifest things and things that we've desired are all sitting there, but we put all these blocks and pathways into that. And so it's when we release those to find out where our home truly is that all this unlocks. And they've been there waiting all along. They're all in us. But to
Yes.
really see those and feel that sense of home is what
Mhm.
I love, and why I think that kind of leads us straight into the genius, is figuring out what is that genius inside of us. But we'll pause for that on a moment. We'll get to that, and because we'll start with number 2. What is a special family tradition or ritual that brings joy in your household and encourages connection?
So for my family, for me and my 2 boys, What works for me, and I am so grateful that I see it working for my boys as well, is long hugs. So they're not every day. They are not a tradition like an annual or something. It's like every 3 or 4 days or so, I will ask my kids, can I get a long hug? So my older son is 16 and in high school, and he has all the usual problems of a 16-year-old, plus he navigates the social emotional challenges that come with autism. So it gives him, he pauses, he considers, and then he lets me hug him and he returns the hug. So that's one. And with my younger son, who is nonverbal mostly, but I get so many hugs from him and just from behind. And so that's just something that I love to continue.
I love that so much. Actually, this morning I was just having one of those mornings and just ready to melt down completely. And actually, I cried as they were all leaving. But I paused, and my daughter was making her lunch, and I was like, "Can I just get a hug?" And she had her headphones on, and then she kind of like gives me a little tap. I'm like, "No, can I have a proper hug? Mama just needs one." She actually took her headphones off, put everything done, and like turned around and gave me her full attention. I love that so much because I think that's so powerful when we give each other that undivided connection and attention. Oh, that's so inspiring. Leads us into number 3 as we're opening up the conversation, because as I say, I call out busy mamas because that's how we identify ourselves a lot. How are you doing? I'm busy doing blah, blah, blah. And so I want to change that conversation to either some people answer the question, changing the question itself, like how you're doing is not a very good question, but we use that a lot. Sometimes it's the answer of not identifying as a busy, but what are other ways we can identify? So however you want to take that question, I'd love your opinion on that.
So, thankfully, I haven't fallen into that busy trap. Like what I do is like when I find myself like that, I have a lot to do, I actually find it gratifying and productive and really it feels good. And what I find is that to me, this question, how I would see it is like when it depends on who's asking, right? And what place they're asking from. You know, are they seeking a true connection, or is it a perfunctory question that we are so used to asking, right? Many times people say, why don't you really answer? Like, how are you really doing? But I'm like, but are you ready to hear? So it really depends on, first of all, who's asking, what intention they're asking with. And then to me, the real thing is like just seeing people, like truly see them. Don't just say something. And if you see somebody who's truly busy, it depends again on your connection with them, but just offering that, I'd love to hear. Tell me more. Can we spend some time together? So to me, I think it all just comes down to that, like really seeing people, really noticing, so I think that's how I would do that.
I love that. And I love that. Tell me more, because that one actually is starting to germinate a little bit from different people. And I love that concept of like, let's really truly look in their eyes and really be part of that. And as looking at someone's eyes, a little trick to that is looking specifically at their left eye only.
Mhm.
Because it releases in you, when you're looking at both, you still have that flight or flight in you. But looking specifically in the one eye gives a truer connection, releases some of that from yourself
Mm.
so you can have a deeper connection. So let's start doing that a little bit more and asking them, tell me more. I love that. Number 4, describe what genius means to you. So we're getting back to that. And how do you feel when you're in your genius?
Um, I think, again, it all comes down to being connected to self. And I feel that when I'm connected to myself, I'm connected to everybody, right? Like if I'm really standing with who I feel, it's hard to explain. It's a bit of a nebulous concept, but it's like if you feel connected to yourself, I just feel connected to people, the world, the trees, whatever, everything. And yeah, and just really being present, you know,
I love
I
that.
think
And I
that.
think the more that we are in the moment, and I love how you're talking about the connection, because it just brought another thought to my head is that a lot of times we're in a room and we're talking to someone, but then our eyes are always looking around to who else is here and not giving that person in front of us our full undivided attention. So I want to challenge that concept out there to that person who's in front of you is there for a reason, and to
Mhm.
acknowledge that and to think about that and give them and be in the present with that person, regardless of who's in there. See what you can exchange with that person and feel that connection rather than worrying about what's around you. And it'll make all the difference.
Mm.
And our last question for today is, how do you encourage your child to explore new skills or passions and live in their genius?
So what I do is, teenagers go through this phase of rebellion and like asserting themselves and all that. And what I find with my child is that, sometimes he'll come across as, he'll speak in a tone or in a way that'll take me by surprise. Like, where is that coming from? But what I always do is I just am so intrigued by the change in tone or the nature of the question that I really kind of take a pause and I just reflect it back to him. And so we'll discuss whatever the question is, and then I'll ask him, was that a nice way to ask or say or do? And then that kind of helps him see it in a way, and then he'll understand that maybe he could have done a better job. But by not rising to the bait, but not just getting, not just snapping, not it's just like, it's okay. I've got some resilience. You can take some chances with me. And I just find that it is helping my relationship with him so much that he feels comfortable to tell me anything and everything, but also learning, the rules of social behavior, which he's been quite late to learn those. So I think just giving space, I think, is my way of doing it with my kids.
I love that. So we're coming to an end, and actually, I do want to post a comment from the audience where Cherie said, "Thank you, Dr. Simon and Michelle, for keeping the issue top of mind." And I think it's so vital on that note. And so, throwing that idea back out there is, how can, if someone wants to work more with you, or what information can they get directly from you? Because this idea of menopause needs the conversation to continue.
A lot of conversation is needed. And so the best way to connect me is on my website. It's called Aruna Med. So it's arunamed.com. And I actually created a link for mamas. And so I think, Michelle, perhaps you can share it. It's called arunamed.com/mamas. And so when you click on that, it'll take you directly to my homepage. And in the appointments section, I have created a special appointment, a discovery call, a 30-minute free call with me if you want to discuss any symptoms you're having, how to speak with your doctor, what things to bring to your doctor, what kind of information to bring to them so that they will consider your case more fully, the menopause questionnaire, or any other questions like that. I'm happy to discuss those with you. So I would love to hear from any or all of you. My email is hello@arunamed.com. Any questions, comments, feedback, I would love to hear.
Thank you so much for coming on today. You opened my eyes to so much and given me so many ideas. And I think that's what this is all about, is finding that genius in each one of us. And part of that is navigating this idea of motherhood and our bodies and all of this, and not hiding that anymore, and having these conversations and realizing, finding the right people sometimes to have those conversations. Maybe you don't want to have this conversation with everyone, but to at least start to approach that a little bit and to open up and make those connections. And let's start trying to look at people in the eye just a little bit more and have those deeper connections, whoever's in front of you at the moment. Thank you so much for coming on today. It was such a pleasure to have you. Such a wealth of information. And we'll see you next time on the Mama Hub Genius podcast. Bye, everyone.
Sounds great. Thank you. Bye-bye.